Once they say it's cancer, you just sort of go off in a fog. You just, nah, can't be, you know. Well, went to see the radiologist at Wentworth-Douglass. She says, you know, you could do this new thing that we have, which is mammocyte. It was one of the best things that I didn't have to go very far. I didn't have to go to Boston. I could just go down to Wentworth-Douglass Hospital, and they have everything there. And they seem to be even ahead of, I'm thinking they're ahead of Boston. I did have the mammocyte 2 months ago, and I'm feeling great right now. I really am. It's amazing. And I just can't picture having had the operation and feeling this good this soon. And it's a nice feeling. Really is. It's a good feeling.
I believe that that Wentworth-Douglass Hospital is the first hospital in southern New Hampshire to install the high-dose rate unit. And even now, there's only 3 hospitals in all of New Hampshire that has that technology. But the high-dose rate unit went in back in, I think, 2003.
It's about three or four years old. I think it's 4 years old. You know, and it actually speaks to the administrative support of this hospital, because
absolutely.
I remember the day that one of our partners called from another hospital, saying that they had tried to get the hospital to approve HDR there, and it was going through all sorts of budget things. It was in October. It was it was several days before the budget had to come in here.
Right.
And I went to our physicist and I said, what do you think about getting HDR to Dover? And he said, you know what, we have a budget meeting
in a couple of days.
No, later today. Later today, let me see if I can run some numbers. And seriously, within 2 or 3 days, we were all set.
That's amazing.
And that's
not that dissimilar to the new program that's coming in with stereotactic radiosurgery. We recognized a need within the community to bring this new technology, which is an incredible advance in radiation treatment.
One could even call it a quantum leap.
Absolutely, you could call it a quantum leap. It is revolutionizing the way we deliver radiation treatments to patients, because it allows for such advanced and precise treatment planning that we can essentially do surgery on patients. It's almost like doing surgery without ever using a scalpel or putting a patient under anesthesia. And it's such an important way of treating patients with inoperable brain tumors, inoperable tumors of the spine, inoperable tumors of the lung, liver, pelvis, kidneys.
Well, I think you are getting so much better. Sit up for a second. Can you tell me how you keep your body healthy?
Every time after breakfast, I eat some vitamins.
Oh, very, very good. Well, I think you're going to be healthy for a really long time.
A year ago, Chase had been homesick for several days, and one evening he seemed to be getting sicker by the minute. So we brought him into the hospital, into the emergency room at Wentworth-Douglass Hospital, and within 30 seconds of the doctor coming into the room, they had diagnosed him with Kawasaki's. And that meant we need to be admitted to the hospital so that he could meet the next day with a pediatric cardiologist and get some important medicine. We went up to the pediatric floor in the middle of the night, and as we arrived on the floor, there was Kara, one of the nurses, in his room to greet us in the middle of the night, which was a very nice feeling. She was very warm and comforting, and it was nice to be able to see a smiling face in the middle of the night when your child was very sick. Due to Chase having Kawasaki's, we needed to have pediatric cardiology follow-up, so we've been fortunate enough to follow up with Dr. Garthier. Chase had his 1-year follow-up with Dr. Garthier a couple weeks ago, and it was such a wonderful experience to walk into the waiting room at Chad and see all of this child-friendly toys and furniture, and see him be excited to be here, and to be excited to have an echocardiogram, and to be excited to see the pediatrician, the pediatric cardiologist again. And it's been comforting to know that right here close to home in this hospital we can come to a place that's so inviting and geared towards your child.
Close to 1,000 babies are born every year in our busy high-risk birth center.
My experience at Wentworth-Douglass Hospital was wonderful. Mine and my husband's experience, both of us enjoyed it. They were extremely accommodating. They were caring, nurturing. They met all of my family's needs. They made my husband feel like he was a part of it. The nurses were hands down the nicest people. The biggest challenge for me or concern was breastfeeding 2 twins. And at 2 o'clock in the morning, the nurse was in there with me, Megan, who for my whole life I will tell her name as a part of my birth story, sitting there with my husband sleeping, not aware, breastfeeding 2 and helping me through it in the middle of the night when I'm exhausted. To this day, her face is imprinted because she was so concerning, like so caring and nurturing, and just helped me with the whole breastfeeding thing, and that was the best. You have an amazing facility that you can get to in 5 minutes, that provides jobs, is always up and coming with new technologies, and it's 5 minutes from your door. It's a reason why you would want to move to the town, and you just know that they're there for you, and they're also giving back to the community in so many different things with all the different community events, which is wonderful.
Plans are currently underway to create a maternal child health unit.